A linear array probe with a musculoskeletal exam type is used to perform an ultrasound examination of an Achilles tendon injury. The patient is placed in a prone position with the foot dangling over the end of the bed in a neutral position. The probe is placed over the Achilles tendon in a longitudinal fashion with the orientation marker directed toward the patient's head. The surface of the calcaneus is seen as a curved, hyperechoic structure. The fibrillar patterned Achilles tendon is seen just deep to the skin with the insertion point on the posterior calcaneus. Kager's fat pad can be seen below the tendon as a mixed hypoechoic and hyperechoic disorganized space. The flexor hallucis longus muscle body is seen deep to the fat pad as a striated, hyperechoic structure that can be seen dynamically when extending the first digit of the foot. The Achilles tendon should be scanned proximally as it slowly tapers into the body of the gastrocnemius muscle. Achilles tendon injuries typically occur at the region of the malleoli. An incomplete injury of the tendon appears as a hypoechoic discontinuity in the linear surface of the tendon, often accompanied by swelling of the proximal tendon and surrounded by hypoechoic fluid. The probe should be translated from side to side to evaluate the entire tendon. Chronic injuries to the Achilles tendon are associated with calcific tendinosis that appears as a hyperechoic foci within the tendon with posterior acoustic shadowing. A complete rupture of the Achilles tendon is seen as a total discontinuity of all the tendon fibers, with retraction of the proximal tendon from the calcaneal insertion. The probe is rotated 90 degrees counterclockwise to evaluate the tendon in a transverse fashion. The normal-appearing Achilles tendon is seen as a pancake-shaped structure superficial to the hyperechoic calcaneus and should be evaluated in its entirety by moving the probe proximally and distally to complete the evaluation.